At Penticton Medical Pediatrics, we have a popular practice where we see many patients for a variety of different things, and we try to treat each person as an individual. The thing that's most satisfying during the day is when you're able to take care of people's needs and do it in a way that makes them happy and also takes care of the problems that they've presented for. I think parents are very important as far as the health of their children is concerned. First of all, they of course follow them and they can see when something's going on. I think that they're probably the first person that would see if there's a problem with their child. And I think if a parent says that there's a problem with their child, or if they see a problem with their child, I think you have to take it very seriously because they're with the child all the time. They also determine behavior of their child, how their child grows up. Parents also determine whether there are going to be siblings, and siblings have a marked effect on children. Probably even more of an effect it's now felt than the parents themselves may. And so yes, the parents are certainly probably the most important factor in a child's well-being. I've been in practice for more than 30 years and seen both children and adolescents, and I think over the last 30 years there's been a big change in what we see in the office. I think there's a big shift in types of problems. There's also more preventative care, more prospectively looking at problems that may come up instead of trying to take care of a problem after the fact. Certainly from the point of view of infants and small children, we've been able to prevent more and more infections using more and more vaccines. We have a whole group of new vaccines that are about to come out to prevent many of the illnesses that we've seen in the past. I'm happy to say that it's been a number of years since I've seen anyone with meningitis because of some of the newer vaccines. One of the things I have noticed is that there's far more obesity present. I think there's a decrease in the amount of activity that children have nowadays. There's a big increase in their diet. They're all supersizing it. But they're supersizing it at a time when they aren't burning it off because they aren't active. And there are a number of problems that occur with that. The increase in weight also changes their activity level. The increase in weight makes it more likely that they'll have type 2 diabetes and all of the attendant secondary health risks that occur with that. And so I think that there's a real problem around the country right now. One of the nice things in working with adolescents is that you get to talk with them, you get to interact with them. They're fun, they're lively, they're sometimes different. They sometimes act in a way that make parents kind of turn green or red. But it's really fun to work with them, and they're honest and upfront.